Hi everyone, this is board certified plastic surgeon Sean Doherty from Boston, and the viewer and patient requested topic of the day is marionette lines. So what are those? That's this line here, so that's similar to a marionette or Pinocchio, where their mouth moves around and there's a line of demarcation or definition around the lower face separating the lower mouth and chin. So that's aging. Anything that draws attention to this area or creates shadowing is certainly associated with aging, and improving that is what a lot of people ask about. So the easiest treatment for that is to soften up that fold there, smooth it out with filler. That's not the answer for everyone. It's typically the answer for younger patients that have a slight little indentation here, shadowing that's bothersome, and their skin is intact, their skin is good, they don't have a lot of sun damage, and a light amount of filler can smooth that out. You never want to put too much filler in this area because that can create heaviness of the lower face, which is very not anatomic and looks very non-human. And I think we've all seen some examples of that walking down the street and on the internet. So I like a structural filler in this area, not a full filler, not a full filler that I would put in the cheek or in the lip, but again, something structural. So my two favorite fillers for this are Volor, which is a Juvederm family member, and then Restylane Define or even Restylane Refine for this area. The reason why I like these two fillers are, again, they create structure, meaning give some structure underneath this tissue to smooth this out, but don't create a lot of volume. They don't create a lot of swelling or puffiness. We certainly like a little bit of swelling in the lip, and then we like a lot of strength and volume in the mid face. And so those particular fillers would not be the best for this area. I also think turning up the corner of the mouth with a little bit of filler is also advantageous to improving the marionette line. Okay, so then who would be someone who needs a lot more aggressive treatment? So that would be a more aged person, the one that has more lax skin. And so in the opposite end of recommendations would be surgery. So that would be a face or neck lift. So I've discussed that in other videos, but it's an incision around the ear here, lifting up the skin, pulling on the facial muscles of the lower face that have descended, bringing those up with sutures that are underneath the skin, and then trimming the extra skin around the ear. That brings this up and sort of fixes the problem, as opposed to a Band-Aid, which sometimes filler it. Now, I agree, not everyone should, will have, or wants to have surgery. I get that. So what are some non-surgical options to treat this when you're not kind of that easy filler marionette line patient? So if you're willing to do a lot of things, you can make some changes. Just putting filler in this area might not do a lot if there's a lot of extra skin here. So what can we do to lift up that skin and those underlying structures that's not surgical? Well, let's talk about replacing that cheek. So as we age, our mid-face drops. So putting volume back in the mid-face tends to reestablish the mid-face, which harmonizes your whole face, but also will subtly lift up this area. You never want to have too much cheek that creates a non-anatomic look, but subtly bringing up that cheek softens this drag, and then that will soften that marionette line. Then I talk about ways to tighten up that jawline in a non-surgical way. Most likely that's going to be with threads. So you all know that PDO threads are my favorite treatment. Those are done, placed underneath the skin, lift up here, and as you tighten up this line and pull and create a vector in the more upward backward fashion, you soften that pull on, you soften that drag on here, and then you de-emphasize that marionette line. And then in addition to that, you do these things, then putting a little bit of filler in here, as I discussed for sort of the subtle patient, might have a nice effect. I also think skincare in general helps improve this area. So microneedling, laser resurfacing, or chemical peel can help with this. I also think reestablishing or revolumizing the lip and maybe a little bit to the chin also sort of harmonizes this area. I urge you to meet with a board certified plastic surgeon, a board certified dermatologist, or a board certified core aesthetic and cosmetic physician to discuss things like this. And you also want to make sure that these physicians have a lot of experience with treating patients with these issues. So I hope this is helpful. Please look for other videos. Please send in questions or kind comments. And I hope everyone's well. Thanks so much.